Welcome. Today we're here with Dr. David Fish, who's the Director of Interventional Cardiology at the Texas Heart Institute. Dr. Fish, thank you so much for joining us today.
It's my pleasure.
So we know that you have done so many wonderful things in your career. Today we have just a few minutes to talk about one of your great interests is transcatheter aortic valve replacement. Could you tell the audience what is that?
Well, for many patients, especially those reaching older age, often the aortic valve, which is the main outlet valve for the pumping chamber of the heart, becomes narrowed or stenotic because of degenerative changes of the valve. Ordinarily, this is a reason to do open heart surgery to surgically replace the valve. But in some cases, the risk for open heart surgery is very high for some patients. So for selected patients who have this problem and who are at high risk for surgical valve replacement, now we have techniques available and instruments available by which we can deliver a valve into the valve position through a catheter.
Wow, that sounds very amazing. For years there was only surgical option for these patients. Is this happening in multiple centers?
Yes, they're widespread now in the United States. There is, as yet, only a single commercial valve available, and the delivery systems are large and require a lot of expertise and a great deal of teamwork in order to deliver successfully.
We know that the great thing about the Texas Heart Institute is that it's a huge team of cardiologists and surgeons and support services. So we know that you are one of the great teachers here at Texas Heart Institute. Tell me what you feel about educating these students over the years. What has been your main feeling about this?
Well, we're fortunate here to have had over the years very highly qualified, very gifted students of medicine and doctors who come for their postgraduate training in cardiology here. And among these, a number selected choose to go into interventional cardiology. That is, of course, the branch of cardiology involved with putting instruments in the body and opening arteries and correcting structural defects in the heart. It's been my great privilege to have trained a great many of the operators who have gone out from the Texas Heart Institute into the community and to other places in the country and have brought forth the skills they've learned over there.
I know that you have been my favorite teacher in all of my career, and I thank you in front of the world for being such a fabulous teacher about cardiology and about life.
You're very kind.
Thank you. We just have a few more moments. What would you like to tell the public about the Texas Heart Institute and perhaps getting their evaluations done here?
Well, the Texas Heart Institute has a long tradition of research, patient care, and of course teaching. And in this kind of environment, I think patients get the best possible care and the most astute kind of understanding of their problems and their specific needs. In addition, of course, with the critical mass achieved here with all of the different researchers and the different clinical efforts and the different programs, every patient has a chance to get the very best of what cardiology has to offer.
Well, we thank you so much. You've been such a tremendous force here in the Texas Heart Institute and in my life, and I want to thank you.
Thank you.